Hey guys, so now the election has been decided and President Trump is elected president, he's beginning to build out his administration. And some notable appointees, if you look, have been actually put out there, such as Vivek Ramaswamy, Elon Musk will lead government efficiency and that whole drive. And surprisingly, even Republicans, former Fox and Friends host Pete Hegseth, a longtime Trump supporter. So what I'm going to discuss today, I'm going to focus on the appointment of RFK Jr. as the health czar and what it means to Big Pharma. Because before even being appointed, RFK Jr. called for measures, for example, to lower drug prices based on an op-ed that he wrote in the Wall Street Journal back in September. One of the key issues for many on both sides of the aisle, of course, is the discrepancy in drug pricing between the U.S. and other countries, where drug prices for the same products are much, much lower. I've discussed this in other videos, but pharma CEOs point to the PBMs, remember they're the middlemen, as the key factor for the price hikes in the US. Another key area that RFK has criticized and will likely still focus on is vaccines. He's been very skeptical about their safety. He's also discussed NIH funding and the fact that the focus of the funding should shift to more preventative and alternative approaches to treating disease. One of the things to note is that in today's market, by the way, over 65% of scientific research in general is funded by pharma manufacturers. So I think it's important to understand that most of the science we consume today is heavily supported by the private sector. The one area that I wanted to discuss a little bit more depth is drug advertising, which Kennedy has an issue with. In particular, he does not like the whole direct-to-consumer pharma advertising, which I discussed in more depth in a previous video. I'll put a link to that below. Remember, pharma companies spent a lot of money. Last year, $3 billion in advertising for the 10 most promoted drugs. And health coverage in the news may be influenced by these big pharma sponsors. And this brings us to the crux of the matter, and that is this. How can pharma companies really ensure that they are minimizing conflict of interest in providing information to patients and healthcare providers? I think it starts with properly accrediting these folks, certifying these folks. You guys know, if you're following me, I'm a big supporter of this. Some say Kennedy is against traditional medicine. I don't think he is. But I think the issue is the trust factor, especially post-COVID. Let's face it, the American public is very weary of big pharma. And look, I'm saying this as a former pharma exec myself. We need to build greater trust with the healthcare community and the public at large. That friendly pharma rep who comes in and visits doctors with lunches and goodies, how do we know if they have the competency needed to do what they're doing effectively and compliantly? Pharma companies train the reps, don't get me wrong, but they focus on drugs and disease state. Companies like the ACMA, which I oversee, we accredit and certify these professionals to make sure that they're meeting the basic minimum competency standards. And that's independently verified by an outside organization like the ACMA. No different than what other professions do. For example, think about physicians, lawyers, accountants, pharmacists. They're all certified by taking an exam and licensed. I think we're on the cusp of a new era in the world today, and it feels like that. And in pharma, social proof, trust, and integrity, I think are going to be paramount more than ever. Time will ultimately tell how impactful Kennedy will be in cleaning the healthcare front, if you will. All right, if you like this content, be sure to give us a thumbs up. Comment below, let us know what other types of comments you like other types of topics, rather, you'd like to learn more about. I'll talk to you guys soon.